Goodness Health is very unique, and I've never come across anything similar to Goodness Health. It takes the good parts about medicine and emphasizes it. My name's Alyssa Sieber. I have been with Goodness Health for about 2 years. We take care of a lot of patients who do not have the ability to get out of their house and see a doctor, because especially for those patients or the patients that live in a rural area, it's very difficult for them to see specialists. We have a company that could come to the house to do blood work. We have another company that could come and do x-rays, ultrasounds. They could do EKGs at the house too. We find a pharmacist that's close to them. We find specialists that are close with them, even if they're in a remote area. We have the ability to see them very frequently and see our patients multiple times a week if we need to. So we don't just focus on medicine, we focus on like the whole patient too. We get to really know them because we see them very often. A few months ago, I saw my patient Amy, and I've been seeing Amy for well over a year. Recently, she had a UTI, and she's had UTIs in the past, but this was very different for her. It turned out to be septic, and then she went to the ER right away. She was in very critical condition from the sepsis of the UTI, but eventually she was discharged home, and at home she was given some oral antibiotics. And so I saw her the next day that she came home, and because I've been seeing her for so long, I noticed that she didn't look very good. Her face was puffy, it was red, her cheeks were very inflamed, and she looked a little swollen. I asked her, you're not looking very right. What's wrong? And she's like, I don't know. I just started waking up in the morning and I didn't feel very good and I feel like something's off. So I started asking her about her admission to the hospital, and I asked her what antibiotics she was given. She stated that it was a cephalosporin. And I started to tell her, you're allergic to penicillin, right? And she said, yes, I'm very allergic to penicillin. I stated that I was very concerned because she's never taken a cephalosporin antibiotic before, and I thought she was having a cross reaction. So I told her to immediately stop the antibiotic, and I asked her if she wanted to go to the ER. She was very against going to the ER. She's like, nope, I just came from there. If we can treat it here, I would love to do that. So I said, okay. Because I can see her very frequently, I saw her the next day. I told her to take a moderate dose of Benadryl. I told her to take it very frequently. I asked her if she had an EpiPen. She did not, so I prescribed her one. But I saw her the first thing the next day. She looked herself again. She didn't have a puffy face. She said she felt so much better. I changed her antibiotics to something different so that she can still get control of her UTI. And everything was good. She was back to her normal self. The fact that I can see her so frequently made me aware of any single change, any slight change in her appearance or actions. I'm able to pick up very quickly just because of our rapport that we have together. It really helps to know when the patient trusts you very much, that they will follow every step that you provided them, every instruction, because they put their lives in our hands and they absolutely trust us with that.
My experience with Alyssa has been wonderful. She's a very driven doctor. She's been just a godsend to me because of the health problems that I have had. And I've had them for a long time. And the past doctors that I've had just kind of dismiss me, attention to like anything I tell them. They come in the room and it's like 5 minutes with me and then they've got to just go. With her, she takes the time to listen and it helps me wonderfully. I've got her number. So whenever I do have one issue or whatever's going on, I reach out. She responds right away. If I need a doctor's appointment that day, she always has openings. I can get into to see her. So the contact with her is just, it's fabulous.
The rewarding factor is the patients that I see a lot and the differences that I make. They are so thankful. When they talk with me, some of them will cry, talking about how Goodness Health saved their life. And it's really rewarding to hear something like that, because you know that if they're crying happy tears, that you probably did very well for them.